Let me get
All
on.
right, we're live.
We're gonna be
No. Rock 'em. I mean, very minimal. I mean, it's like an earthquake. If you plop yourself down in it.
Sometimes during
You know, fidget a little bit. You know, you gotta pretend you're fidgety. Anyway, for anybody out there watching this, we just had to test. The camera is attached to the first pew now, which I did not notice, but apparently it's been done for like a week or more.
a couple weeks.
A couple weeks. Yikes. I'm not super observant, but anywho, I thought I was, but apparently not.
So if you're super fidgety and you want to sit in the front pew, we figured the front pew is safe because nobody sits in that anyway.
We're Lutheran. We don't want to sit in the front pew. At the closing ceremonies for FEC yesterday, Trisha's like, where would you stand? I was like, we got to go to the back. We're Lutheran. We got to go to the back.
And they were in the far back.
We were in the very
right
back.
against it. But that
We
was
were
a
in the
pretty
very
cool
back.
thing. I mean, both the kindergarten graduation was really cool.
Yeah. They were very enthusiastic bunch of kindergartners.
Yeah. And they had fun marching in. It was pretty cool. We opened the front doors.
Yay. The front doors do open.
They do.
Yeah.
Yep.
Okay. Well, we've got 3 minutes for announcements.
So I would say that we had a very successful strawberry festival.
The weather was superb.
I think we were able to minister in the community, to be a part of, Walkersville, and hopefully our outreach has reached out.
I hope so. I think so.
Well, there's a
It was
good amount of
day.
people in town too, and everybody was excited to be outside, milling
Yeah.
around.
The bishop had his spy in town, so
Oh,
yeah,
Wow.
his dad.
his dad. Well, did we pass? I don't know.
I don't know.
We're still here on Thursday, so I
I'm
guess
still
so.
here.
You're
I
still
haven't
here
been-
on Thursday. But you don't actually, that bishop's meeting's not until after this, right?
Tomorrow, today at 1:00.
Today at 1 o'clock, yeah, so
Yeah,
you don't
so-
know.
So I could get the hook
You
there.
could get the hook there. No, I'm just kidding. We don't let the bishop have that kind of control here, do we? No. I don't know.
But that was good. And then tomorrow we have blood drive. I think last I checked, we're up to like 21 or
Yep, 21 appointments filled out of 31.
yeah.
So we've got some afternoon appointments. The morning's pretty full, but we definitely have some morning, I'd say 1:30, 2 o'clock
Yeah.
appointments were definitely available.
Sign up to be a blood buddy.
Yep. And you can
Is
get
that
your-
for the people who give blood and then pass out? Because I need one of those. I did
I've
good last
been your
time.
blood
I didn't.
buddy.
I know. Yeah. I didn't pass out last time. I didn't even
I
really
know.
fade or anything.
No, you did really well.
I
Eat
did.
breakfast.
I did eat breakfast. I do eat the whole time. Well, the first time probably I didn't eat very well, but the second time I was very specific about eating. I had,
Before you
had
came
bone
and-
broth all week. I had red meat the week, but I still not great. But this last time I did good. So I feel like third time was a charm, and now I'm over the hump, and I'm just going to be smooth sailing.
Yeah.
Next thing you know, 100 gallons. We have, before tomorrow, we have collected 85 units of blood
That's pretty good.
since
85
we started
pints,
last June. So
Yeah. That's pretty good. So
we're hoping to hit over 100 tomorrow, and then that's like 300 lives saved.
yeah,
Awesome.
Yeah,
pretty cool.
pretty cool.
Right.
Anyhow,
So
what else?
if you'd like to sign up, let us know. We'll get you signed up.
Yep. And if you want to volunteer, we've got some
Yep.
time slots for that.
Yep. One thing, over the last week, some protocols have changed through the government, et cetera, for how we deal with COVID, whether it's masked, not masked, et cetera, et cetera. So at council last night, the Worship and Arts Committee was tasked to review our protocols so that we can prayerfully look at what it is that we need to do to love our neighbor, love ourselves, and be good stewards to the health of our community. So Worship and Arts is meeting on
Monday.
Monday night to revise or review and make a recommendation as to what we're going to do here at St. Paul's because of the changed guidance from different entities.
So what does that mean for Sunday this week?
So Sunday this week, we are still in our same posture of you have to come in, get your temperature checked, you have to check in at the
Usher station?
at the welcome station, so to speak, or whatever. Sanitize your hands, you have to wear your mask, and we still have to be distanced. And that's just because we have not had the opportunity to change our protocols, which in doing things safely and trying to think of the right word here.
With consideration, yeah.
Considerately, right, for other people. We need to have that discussion, and then it's not going to be a long time before we may have different protocols, and because a special council meeting will be called once Worship and Arts has their recommendations put together in a viable format, and then we'll be able to notify you once that's done.
Full PowerPoint presentation. No, I'm just kidding.
No, not another 60-pager.
Not another 60-pager. That was a long.
This will be an
It's a long
addendum
plan.
to that
Yeah.
protocol, but it's something that really, in order for us to look out for those who can't look out for themselves, or just so that we maintain some sort of I don't know, trying to think of the words, but they're not coming today, so you
Well,
two might have to talk.
Then it could be an interesting gathered at the table. But I think it's also, I mean, I've said this to a couple people, not that everybody listens to me, but I've said it to a couple people. It's nice to have a record of what our thought process was.
Yes.
Because, St. Paul's went through the Spanish flu in 1917, and the church's history just skipped over that time. There's no what they did, how they reacted, how they got back together again. And it would be nice for future generations to look back and say, all that craziness in 2020, what did they do? 2021, how did they reopen? That's obviously not the first concern, but it's nice to have the written plan, see the consideration,
Yeah. And we have to
and the response of people.
And we have to make sure that we're being faithful to our community, to look out for them as we would want others to look out for us.
Health is a shared endeavor.
Health is
Oddly
a shared
enough,
endeavor.
it is.
And you've got one more announcement. Let's see if you can remember what it is.
Probably not. I told you I'm at a loss for words today.
Sunday, 8 a.m.
Oh, Sunday, 8 a.m.
Oh, yeah, that thing. Maybe that's why. Maybe you're still running sermon topics through your head.
I haven't even started.
Oh, no.
You're supposed to
plug for
think
sermon.
that.
Because
not
I'm at a
say
loss for words.
Ooh, that was the filter. Anywho.
Yes, we are having outdoor worship at 8 a.m. on the lawn, and there will be communion. That's something that we're going to try at least through probably September, October, while the weather lasts, so that people who are still tentative about coming back inside a building or whatever have an opportunity to share in the Lord's Supper. So that's really
Fourth Sunday of the month.
the fourth Sunday of the month.
Mm-hmm.
Yeah, that's really what we're aiming for in that worship, and for people to be able to gather together and just share a different type of fellowship.
So mask or no mask?
I will be wearing a mask to distribute communion.
Mm-hmm.
Well, from what I was told by a person who kind of set this up, they said it's sort of two out of three things. Mask, distance, outside. You're already outside, so you can either distance or mask.
Mm-hmm.
And
You
I
bring
think
your
we
own
do.
chair so
bring
you
your
can
own chair.
distance.
People bring their own chairs, and they've been doing that pretty well. And I think I would caution just that there's not a mentality of mask shaming, because there are some people that still have other considerations in their lives or other people in their lives that rely on that safety. So
Yeah.
I think outside we're good without.
Yeah. And if you feel more comfortable wearing one, wear one.
Yes,
and
absolutely.
That's totally okay. I went shopping today, wore my mask.
Yeah.
Everybody else in the store did not seem to have theirs on. And I was like, oh, all right. Well,
Right.
I'm feeling better wearing my mask at the moment.
So,
It's cool.
yep.
It's all good.
Sunday, 8 o'clock outside, 9:30 or 9:25 inside with live streaming too. So no live streaming outside.
No live streaming outside.
Right.
Just inside. Or you just hear the birds and
Yep.
yeah.
Watch.
The camera is now affixed to the pew. So I just really can't believe I didn't notice that.
Or you
Anyhow.
watch the nature in Belinda's yard play out as we worship.
Yeah, I still have chickens there.
Yeah.
They'll be in the way. And Delaney's car has come back from the shop, all tagged and titled and ready to go. So now we really
Now
do
you
look
just
like
gotta
a
get
used
Delaney
car
out of the
lot.
house, right?
You know, I mean, we've got almost every color car out there. So apologies. We'll just make sure there's none parked in the grass. That's all I can promise. That's all I can say. Anyway,
Alrighty.
so on to our social statement, caring for health, our shared endeavor. We are on, well, we stopped at page 12. I don't know if we're picking up at page 12. That spoke of advocacy. We talked a smidge about that,
Yeah.
working towards a better health system.
And what advocacy really is talking about in this statement is that we are there to promote public policy that promotes health for everyone, healthcare for everyone, and that's really
Equitable
where we.
healthcare.
I'm sorry.
Equitable healthcare.
Yeah, so that everybody has equal access, and that's there for that's really what we're called to do in advocating. Not only that, but also, which has been pervasive throughout this statement, was being an advocate by being with those. For that's really, if you think about Jesus sending us our advocate, our paraclete, or the Holy Spirit, it was to be with us while we're missing his presence.
Pentecost. Notice we're all decked out in red for that already.
And you didn't think I had one.
You're just going, you obviously. All right. Advocate. Good one, though.
Yeah.
Good correlation there.
See? Sometimes I can pull it together.
Yeah, you got some words together. Good job. All right, so where are we moving on to from advocacy? Do we want to talk about public health services?
Yeah, so, again, we know that there are public health services. I worked with them quite a bit, through the Department of Health and Human Services in DC, and then for other projects where those are the folks that are trying to figure out how to best provide that medical care in our society, and that's something that we need to show our support for, and really again push for that type of thing. To me, as opposed to other ancillary things, I think healthcare really for anybody is probably one of the most important aspects of our lives, because our lives depend on it.
Yeah, it's hard to do anything if you're unhealthy.
Yeah.
I think the part that I didn't think about was the preventative measures that they brought up. Reduce the risk of injury, promote healthier lifestyles. I know that's all a part of healthcare, but when I was thinking healthcare, I was thinking you're sick and you need care, instead of maybe promoting prevention.
Well, you look at different things are labeled, Surgeon General warns, or, you know, that's what, you know, the Surgeon General is the top public health official in our country, and that's, you know, what they're trying to do. Not that we always agree with what the Surgeon General says, but, you know, I think, you know, there's good measure for us to really pay attention. And I honestly, since we started this social statement, I've been doing a lot better. And even Sue said to me the other night was, wow, you're really being good with your walk. 'Cause, you know, yesterday it was 90 degrees. I'm out there doing my walk. I'll do it again today. But
Sweat out all those toxins. Good
yeah,
job.
and
I did mine at 8 a.m. because it wasn't 90 degrees.
And I may have to adjust my schedule a little
Yeah.
bit, especially with the summer coming. But
Diesel and I were out pretty early when I saw it was going to be 95, and I was like, guess
yeah.
what, buddy? We're going early.
Yeah,
Heat stroke is a real thing, and that's also a health thing.
It is.
It can be prevented.
Yes.
It was a little warm of a ride going home on the motorcycle last night.
I bet.
But, you know, so
You just go faster, the wind goes.
ain't go faster.
Just kidding. So, on to page 14.
Yeah, and this is something that you brought up, Lynn. It was whole patient care.
Right. I just read I just read this
Oh,
section. It was just, whole patient care. Yeah. I mean, with mental, physical, spiritual, it's all together. They're all connected for me.
And I think, you know, I watch, you know, a couple of programs. One is like this one called 911, and on the episode the other night, the one main character's mom was having fainting spells, and then they took her to the hospital, and, you know, the doctor kind of, get on out. You know, they didn't really do any, you know, checks or anything, but then, you know, the mom got sick again, and they brought her in, and it just so happens that this one main character with two of her friends are studying for medical school. So they kind of went through a whole list of progression of what the probable issue was, and they figured it out. And then when they took her to the hospital, they were able to diagnose that she was having an aortic aneurysm or abdominal aneurysm, which is in most cases fatal when it happens. So I think that's really what we rely on with our medical personnel, is for them to do everything possible to figure out what it is that's going on with us, as opposed to just like, take 2 aspirin and call me in the morning. You know, I think we really need to.
But from your antidote, I took from that it's also our own responsibility to
research.
To research, to be fully honest.
Yeah.
Some patients aren't fully honest about what their issues are, especially if it's, a mental health sort of issue and it's manifesting in a physical way, but they don't want to talk about, what could be going on in their mind that's causing the physical issue. That's what I hear about
Yeah, I agree with you.
with the whole patient care. And it's almost unfair to put that on your physician.
No, but
alone.
I think, no, not alone, absolutely. Yeah. But I think there's also, a responsibility to, and I get it, doctors, nurses, et cetera, are overworked because of, but I also think there's a responsibility to give the best that they can.
Oh yeah.
Right.
Yeah.
Well, they're not magicians.
No.
Right.
And they're people that have studied something. So
Right.
you have to take
They have that extra special degree.
consideration. Right.
Yeah.
But I know that the appointments I've been to, they do always ask about stress in your life and certain things like that. So they're looking at some of the mental parts as well as the physical thing to try to, get a full scope of what's going on.
Right.
Yeah. I don't, for those of you who have teenagers that do their well checks, our physician now anyway does a kind of a mental health survey that they have to answer at their appointments, just to get kind of a scope. It's statements, and you're like, how do I agree with that? I don't agree with that. Just to kind of help with maybe uncovering a situation that maybe they're not even aware of. But the physician can look at that and say, maybe we need to talk about that
A little
today.
bit more, right,
Yeah.
yeah.
But
And
I'm glad that they're
doing that.
doing that.
Right, right.
Mm,
Now, I think Russ, you pointed out the next one that you had highlighted, that next statement
Oh, the
there.
curing and caring.
Yeah,
mm-hmm.
Yeah, it says we can always care even when we cannot cure. So a cure isn't always the solution, because some of these things there aren't one. You know,
right.
there isn't one for it. So, care and you help people along till,
And I
they
think
reach their
that's-
destination.
Yeah, you're standing alongside, you're being there with someone who may not be able to be cured. And that's a tough road. I mean, especially you see it a lot with dementia patients or people who are losing that type of cognizance.
Any long-term.
And it's, the cancer, it can be just as debilitating on those who are walking with you in that journey.
You're skipping
so
forward a couple pages to the caregiver support.
I didn't, but
That's all right.
But yes, yeah.
yeah, I think that's, really what we have to be aware of and kind of feel that out for, especially family members or close friends or whatever, that when something's not right, and then you can just be there to be that support, even though there might not be anything that you could do.
I think it was important to bring up the palliative care. That this statement supports palliative care. I know some
Yeah,
belief systems may not
right.
specifically, but this was supportive of palliative care and making patients comfortable
And
as possible without detriment to other things, obviously. But
I get that, especially with, chemotherapy and stuff like that, where, okay, I've been through 5 or 10 rounds of chemotherapy, and I'm not doing it again, because it just takes too much out of me. Well, then I believe and that we need to respect that, and we need to support that, so that, then we provide with those people with the most care and love that we can for the rest of their time that they're available with us, and we just make the most of it.
which then leads to
Which then
peaceful
leads to
dying.
peaceful dying, and it says in here, in placing our trust in the gospel's promise, we are freed from the power of death and the need to cling to life at all costs. And I think that's where we don't necessarily resign ourselves to death, but we resign ourselves to putting our trust and belief in God that what's next is what was planned for us. And, we have that, I don't know if right's the correct word.
But you should have the dignity.
Dignity, there you go, yeah,
Yeah.
to be able to do and be how you want in, towards the end of your life,
And that they brought up, it's not not about someone who has the resources or cognitive ability to do that, but they're talking about everyone having that. Again, you said right. I don't know to die peacefully. A way
the ability,
the ability to.
and not worry about, and granted, I've been with family members who are like, well, we got to try this, we got to try that, we got to try the other thing. That might be good for you, but that might not necessarily be good for the person that you're in that journey with. And I know I say it over and over again about my sister-in-law, but that's exactly what happened with her. And she she died peacefully in her sleep, and that's what she wanted to do. You know, it was a long fight. It was 18 years, 16 or 18 years, and that's a long time to be in that fight.
Yeah. And I think it was Russ, maybe in the very first session, said, make your wishes known.
Right.
So that there's not confusion amongst the family.
Yeah.
To know what you want.
I mean,
at
Sue
the
and I
end.
had that discussion just again last night, about, how we want to end up and where we want to end up and stuff like that. And I think, the more you have that conversation, the less
Need to
anxious or
normalize it.
the less, I don't know, what's the
Well,
good word?
when it gets to that point, there's a lot of things going on, a lot of emotions with people, and that's one less thing they have to think about.
That's right.
And they don't have to argue about it. Well,
No,
Aunt
Mom
Su-
would have
Aunt
wanted this,
Susie
or
used to like
Dad
that.
would have
Right.
wanted that. and-
it's in writing and it's
Yeah.
out there, and
Yeah.
you may say, well, that's crazy, getting shot out of a cannon on the 4th of July at the fairgrounds, but that's what you wanted.
Right. But it's like I said, my brother wanted his ashes spread in the fountain at the Bellagio. I don't know how easy that would be.
There's a good bit of hedge
Yeah, I would
between
imagine.
the fountain and the public. So, yeah, you might need to launch that somehow.
Yeah, right?
One of those confetti cannons.
Out of a cannon, yeah.
There
Confetti
you go.
cannon.
Problem solved.
But normalizing it. I know, having worked in insurance, people don't want to talk about their end of life plans.
Right.
But it is easier for everyone involved to talk about it.
Yeah, yeah.
And you want to do it while you still have your faculties, because if
Right.
if you end up, you get in a car accident and you can't, tell
You can't
anybody
make
the next
that-
day, then
Right.
Yeah.
Right,
Yeah.
right.
And then I think the next part's super important. The
Yeah.
caregiver support,
Right.
especially those that are taking care of people with long-term conditions, and how we can come beside not just the people who are ailing, but also the people who are caring for them.
Right, and that's, I think more and more, especially as our population gets older and older and older, we have that ability to be able to stand beside those who are caring for the person at this level, so that, they don't falter. I mean,
and we also have Stephen's ministry here,
well, that's
Which-
a big thing.
which gets into the same thing, walking beside
Mhm.
people, and they're recruiting for people to go to a seminar to do that now.
Yeah,
Mhm.
we are looking for folks who are interested in being a part of that ministry. It comes with some great training, and helps you understand how to walk that walk with somebody else. And it's a confidential process. So whatever you and the person who is receiving your care talk about, that's between the two of you, and it doesn't. And that's a promise. That's a, I would say not a promise, but man, I can't find words today.
It's a requirement. I mean,
It's a requirement,
It's a requirement,
but
yeah. But
It's also that confidentiality that will never be betrayed, and it allows people, and there may be some people in this congregation that have taken advantage of it, and it's worked for them. And we right now, I think we only have 3 Stephen ministers. There's going to be some Stephen minister training coming up starting in July. So if you're interested, see me or Linda Yop, and we'll get that process started. But it's very rewarding, and I can attest. I mean, I went through the Stephen leaders training, but I don't minister on that level. I minister on the minister level.
Right.
I like that the Stevens ministers, they still meet monthly
Yep.
together, and while they're not talking about their care receivers, they are supporting each other. So that's
Correct.
still caregiving support. They can be supporting and caring for someone else, but they are also the Stevens ministers themselves caring and supporting each other, which, I mean, is a huge component. I know you know, pastoral care.
Yep.
I
It's
hope
on the
you're-
same level.
Yeah.
You know, it really is.
You're, you know, meeting with other pastors and, you know, leaning on each other with the things that you have to deal with.
Yep. But if you feel that you would benefit from somebody in your life, such as a Stephen minister, or just need to talk to whoever, you know, let us know and we can put you in touch, and nobody knows who is talking to who.
Mm-hmm.
So it's a very confidential thing.
And Diane said, Linda is the best, and I second that. Indeed. So moving on to research and technology development. This is another one that can have a little bit of contention between.
Yeah. So I think the first line the church recognizes that the fruits of medical research and innovation are often means through which God blesses and heals creation.
Yep.
So,
Yep.
you know,
Yeah.
when it's your time, and you don't need to necessarily go to extremes, but they do say technology's good. It makes things better, you know.
Yep.
We can heal some stuff.
It can, heal afflictions, relieve suffering, and promote well-being. I mean, and it goes back to that prevention thing. Some of the things that medical research and technology come up with are to keep you from getting to that point.
Yeah, and I think we have to realize too that we can't rely on technology itself.
Yeah, there's no magic pill to cure
Right.
everything.
Right, the only
Darn
magic
it.
pill was,
I thought it was Jesus.
that I was just about to say that. I just need to touch your coat.
All right, so do we want to move on to professional education other
Yeah,
than,
but
you know,
I think.
come on, college
the-
education.
The one,
Oh, you're still up there.
yeah, the one thing that I saw in here was healthcare research should first address medical interventions that are likely to improve substantially the overall health of the general population. So working for the
So
greater
not
good.
calf implants or things like that
I was
to make your
thinking about
calves
some
look
of them.
better.
Yeah. I think that would generally make the whole population happy if we all had calf. And
Yeah, no, I don't
no,
need them.
I don't think so.
So, I think the next, equitable access to health care for all. And according to this, it's a matter of love and justice. And that's really what it is.
We're skipping to page 18 for those
Did I?
of you
Sorry.
following along,
Sorry.
which is totally fine. I just know some people are following along. We need to have page numbers. So,
Yeah. So, you know, in response to God's love, we work to promote the health and healing of all people. Just like we work to promote fellowship with all people, no matter what. It doesn't matter, pink, purple, blue, green, whatever. It's for everybody.
Well, it's just like all these social statements.
darkly.
They're all about sustainability and adequate everything for everyone, which is, you know, everybody should at least get a 5. You know, everybody doesn't need a 10, but everybody should get a 5.
Yeah.
C plus work.
See,
Right, and it's mentioned again in here is that, you know, a just society is one that supports health of everyone. You know, and that's really, you know, you look at health and wealth and it's the same, you know, we should be supporting everybody there.
yeah, I liked the quote. I don't know. I'm guessing that's 1 John 3:7. How's God's love abide in anyone who has the world's goods and sees a brother or sister in need and yet refuses to help?
Right.
That's kind of like a great filter. Like, do I have the means to help that person? Then I should.
Right.
The end. No.
So,
Keith said, just not only on ability to pay. Yeah.
right.
It's
I mean,
difficult for some people. I mean, I know that some people are making the choices between medications that they might need or, you know, shelter or food,
Yeah,
that are
and-
also necessities. So how can we get to that, like Russ said, that baseline of 5 where everybody's at a,
Right, and we saw it during the pandemic where privileged people were moved to the front of the line because they could be. And that's really shouldn't be, it should be, you know, for lack of a better term, spread the wealth and spread the health.
Well, if everybody has their basic needs met, you don't have as many things drawing down on everyone, you know? If you have a lot of people on the bottom that are really in need and are dragging everything down, if you bring them up to adequate,
Right, then it's not gonna be
yeah.
there. Yeah, absolutely.
the rising tide lifts all
Yep.
boats.
yeah, I think the pandemic really kind of shone a light on the disparity between communities
Yes,
and resources.
right.
I don't know how to fix that per se, but it really did bring that to light more so than anything else I've seen in the last couple decades. But anyway, what page are we on? That's 18.
18,
Are we
19.
skipping to 19, moving towards just access?
Yeah, and again, that's exactly what we've been
We
talking
just
about.
talked about,
You know,
yeah.
it's about having, like Russ said, being able to tip the teeter-totter back to an even keel.
And it doesn't mean that people won't have more here, you know, it doesn't mean everybody has to have the same, but everybody should have the same baseline. And if you rise above that baseline because of hard work and everything,
Yep.
or choices you make, great, but everybody should have the same, start from the same
Starting
spot.
point. Yeah, a starting point that meets all your basic needs.
Right.
And that's sustainable. We talked about that, right?
Exactly.
Are we ready to jump to the conclusion?
I think.
It is
The ethical guidance.
12:33 and we are on,
Did we go through the ethical guidance?
that was
Yeah,
that's
that's-
page 21.
Yeah. So just highlighting a couple things in there, you know, health and finitude. We must accept the limits imposed by our human ending and have realistic expectations of healthcare because much like everything, our resources are finite. So there's only a certain amount to go around and we need to be able to spread that around. And you know, love, you know, it means giving ourselves for the sake of others' well-being, doing no harm, promoting the well-being of neighbor, and treating people with respect and dignity as children of God. But then, in the realm of being a good steward, it also gives us kind of a check and balance where we are commissioned to use our health and our health care wisely. So doing the right thing by being healthy and living in a way that pleases God so that we are thankful for the gift that God gave us in our life. Because, you know, we are created in God's image, so we need to, you know, maintain a pretty high standard, I would say.
And I just want to go back to, you know, I just have this feel that sometimes you're like, you got to be healthy, or you've got to be healthy to serve, and I don't want that to come out as what we're saying at all, because
No.
you can't, you just can't sometimes. There are conditions where you just can't be healthy, but you can still
You can still
you
be a
can
part of community.
still
right.
be part of community and still
Right, and I mean,
praise God and
Absolutely.
use the gifts that you do have
to your best ability.
to your best ability. Yeah, I just didn't want it to make it sound like, you know, you got to be healthy, because,
No,
you know, we're all ailing in some way or another.
absolutely.
All right, do your best to be as healthy as you can be.
Right. Yes.
Everybody's got a different level.
Yeah. You've got a responsibility to be the best you, no matter what level that is.
Right, and don't be afraid to share that with others. You know, if you're struggling, share so that someone can come alongside you and someone can be that partner, that advocate, that counselor and not really counselor, but just that person who you could lean on to get you through those tough times. And I think that's important for us to have that in our lives.
And you don't know what sharing your story or your pain or your struggle is going to help validate someone else who may be keeping that to themselves too.
Right. I didn't know that there were other people that went through this.
I was like, you didn't know what I was like, I was like, you didn't know what. Anyway, carry on, move on. Okay.
And scene.
I was just like, what? All right. Sorry, go ahead.
But,
Number 4.
but that's what I'm saying,
Yeah, that's what I'm saying.
There could be all of a sudden that epiphany moment where you're like, wow, you've been through that?
Right.
How do you, and like you were saying about how St. Paul's made it through the yellow Spanish flu. Okay, so now in the next 100 years, if something happens, we have a basic roadmap for someone to follow.
Right.
And we don't have to reinvent the wheel.
Right, and at that point, they may be able to look back and say, oh, they should have done this instead of that, and they can improve on what was done in the past.
That's right.
What you're supposed to learn from history, not repeat it.
So,
Isn't that the definition of
history? Literally, yes.
But and then we in our conclusion it just says the gospel offers the world the hope of abundant and everlasting life that liberates us from idolatry of health and fear of death, because death has already been conquered.
Yeah, I think that's a big point.
Yeah.
So do we have any questions or comments about the healthcare? Our shared endeavor. It's all about community and doing it together, which, it's kind of hard, I think, sometimes with health.
I think it is.
That's why it's repeated so often, because I think it's hard. I think it's hard to talk about your struggles sometimes. I think it's hard to
I think it is, and I think there's, some people may feel there's a stigma associated with whatever they might be going through.
And I think it makes people question. Delaney asked me just this past week, how is it that people still suffer and die when we've prayed for them, and they need healing and it doesn't come through. So I think it's one of those.
But their healing does come through.
Right.
And
that's what we talked about. But that's one of those things where people get hung up on healthcare and why is she better and I'm still suffering, or why
did this person die and not me?
Why did that person die and not me? Right. Yeah.
And everybody has their own walk, and you have to believe that there's a reason for, every walk. It may be helping somebody you don't even know.
Mm-hmm.
Right. So.
All right. Well, I have no other comments here from our viewers.
So going forward.
So this was going to be our last gathered at the table for a little bit.
Season 2.
Season 2.
32 episodes.
32 episodes. So plenty of things for you to go back and review, all available on the Facebook video tab.
And so far, we hope that you've benefited by just the 3 knuckleheads sitting here chatting and
going through some social statements.
Yeah. When we come back in the fall, we're going to start diving into some of the more difficult ones that are really challenges in our society right now. Not that the ones that we haven't gone through aren't, but they're more prominent.
They're kind of the hot button issues.
Yeah. But there's also the opportunity for, some impromptu appearances throughout the summer, and we would love to hear from you if you have a particular topic or something that you wouldn't mind us having a discussion about. So let us know.
And or we might be talking about stuff that's happening here at church. We've got a
Yep.
lot of stuff happening this summer.
Yep.
All good things, as Olaf would say.
Is that what Olaf would say?
That's what Olaf would say. All good things, all good things.
Are you proud that I know who Olaf is?
I am proud that you know who Olaf is, because I mean, it's not like your son was really into Frozen, probably.
No.
At any time, or anyway.
Not anytime close.
Not at any time close, but way to be up on contemporary characters.
That movie's been out for a while. I don't
All
know,
right.
contemporary.
It has been out
Well,
for a while, but
it
still
has.
beyond my
Right. for sure.
reach.
But yeah.
So, anyway, we're glad you joined us today, and we hope that you join us on Sunday.
Yep. So look for some pop-ups this summer, and
Who knows what will be?
yeah, who
We're just gonna
knows?
pop up. It's gonna
Yep.
be fun.
That's right.
Bye.